Are you taking your thyroid medications appropriately and the right way? That is what we are talking about today. By the way, these are not thyroid pills. These are some other pills that I have and that I take, but we are talking about thyroid medications. In particular, I'm talking about medications that usually are taken for an underactive thyroid. Guys, it's really, really important, especially with thyroid medications and others, that you take them at the right time and the right way, because if you don't, you might actually run into problems in terms of the medication being effective or how effective it is. So that's what we are touching on today. I'm Dr. Jen Caudle. I'm a practicing family physician and on-air health expert and video creator. Let's just start right in. For those of you who have an underactive thyroid, you are very likely on medications, and your doctor or pharmacist has likely told you how you should take your medication. But in case that hasn't happened, or if you need a refresh, let's go through some of the really important things about thyroid medications. Okay, obviously you want to take your medication daily unless you've been instructed to do otherwise. But also with thyroid medications for underactive thyroids, typically we want you to take your medication before breakfast. That's right. Only with water. You don't want to take your thyroid medications with meals or things like that. Not only that, let's take it a step further, with water and on an empty stomach. And the reason for this is because your thyroid medication can be affected by other foods or minerals or vitamins or things like that. I'm going to talk about a few. You need to wait at least 30 minutes to an hour before you eat or drink anything else. So this comes to be a timing issue. You know, I'm talking about this because if you're not on a thyroid medication, you might be on others, medications for osteoporosis or medications for cholesterol or others that also have a timing requirement. This is really important to adhere to because it usually plays a role into how well your medication is absorbed, gets into the bloodstream and things like that, and that's going to be really important. So with thyroid medication, usually for an underactive thyroid, you got to wait 30 minutes to an hour before eating or drinking anything else. Now, keep in mind that thyroid medication for underactive thyroid can often interfere or have some interactions with other vitamins and minerals, such as iron and multivitamins with iron, or calcium supplements, antacids, and things like that. So calcium, iron, multivitamins, antacids, and there's even other medications really should not be taken within 4 hours of your thyroid medication. Now let me just jump in here and say, and I always say this, guys, this is sort of a general sort of framework. You've got to talk to your doctor about your medications, what exactly you're taking them for, and how you should be taking them. This is just some things to keep in mind for those of you who are on medications for an underactive thyroid for things you might have been told. But still with this information, because I'm not your doctor, you need to check with your own doctor. And then other things to keep in mind is that for many medications that help treat an underactive thyroid, there are foods such as soy, walnuts, grapefruit juice, and other things that can actually make your thyroid medication less effective. So just keep that in mind. Remember that taking your thyroid medication as directed, as you've been prescribed to do, as is the instructions on the bottle, is super important to make sure that it works properly in your system. Do not underestimate that. And again, check with your doctor to figure out what you need to be doing. Again, this is medications for underactive thyroid, many of them at least in terms of the instructions they have. Guys, I hope this is helpful. Let me know if you're on medications for an underactive thyroid, if you've been told these instructions, if this sounds familiar. This doesn't apply to everybody, but it does apply to a lot of different people. So I hope this is helpful. Guys, I'm Dr. Jen Caudle, practicing family physician, on-air health expert and video creator. If you've not liked and followed my page, I invite you to do so. For those of you who send stars, I respond to you personally. And guys, by the way, for those of you on YouTube, if you've not subscribed to my channel and clicked the little bell for updates, I invite you to do so. Guys, I'll see you soon.